Hi, this is Dr. Patrick at Dentistry Family Dentistry in Washington, D.C. And today we're talking about scaling and root planning, also known as a deep cleaning. This is a common question that a lot of patients have when they come in for a new patient exam. Why do I need a deep cleaning? Why can't I get a regular cleaning? So we'll talk about this briefly. A deep cleaning is when a patient has signs of gum disease, whether it be mild, moderate, or severe. Gum disease or periodontitis is caused by plaque. Plaque that gets hard and it sits at the gum line. When it sits at the gum line, it starts to irritate the gum tissue. It causes bleeding. You may notice a bad odor or a smell, and over time it may actually start to cause bone loss. If we take a look at our pictures here, we can actually see a patient who needed a deep cleaning or scaling and root planning. If we look, we can see that their bone level across is not horizontal and that the patient already has bone loss. If I draw my mouse from here straight across, the bone should be pretty consistent throughout. The same thing with the top arch. So if we look, this right here is the bone, and right here we see that there's a little bit of bone loss or vertical bone loss. If we continue to draw our mouse straight to the back, we can see right here there's also some areas of bone loss. Even if the patient was brushing or flossing, it just wouldn't be removed anymore. Come in for your new patient exam. We'll look and examine and see if we see any signs of gum disease.